Now, this was announced earlier. You can collect chronic medication from more than 300 post office branches across South Africa. The post office said it had trained staff to handle the medication and it used high security storage. The service kicked off last month after a deal was clinched with the Department of Health. But the Pharmaceutical Society of South Africa has raised several concerns about the ability of the post office to comply with rules and keep medicines safe. Now, the post office, of course, is technically insolvent and it is trying to reinvent itself. We're now joined by Jackie Maimin, CEO of the Independent Community Pharmacy Association. Ms. Maimin, thank you for being with us. We're not sure how this is going. It's been marketed by the post office, but I guess if there's still reported problems with mail, the concern is, can the post office step into a pharmaceutical space? Where do you stand?
Thank you for having me. So yes, that is the big question. The track record of the post office has not been good. At the moment, most of us wouldn't even trust them with our letters and parcels. So to trust them with life-saving medicine is a long reach. And on top of that, even if they were a really efficient postal service, they are not a pharmaceutical service. And as you rightly said, medicines need special storage conditions. They need to be handled by trained personnel. So, for instance, medicines in a pharmacy need to be stored below 25 degrees Celsius 24/7. And if they're a fridge line, they need to be stored between 2 to 8 degrees Celsius at all times. This is the only way that you can be sure that the expiry date on your medicine is in fact the correct expiry date. Now, what we're saying is, number one, the post office is not checked by anybody. We are regularly checked by the South African Pharmacy Council. They do not have the temperature control that pharmacies have. So, for instance, where are they going to store things like insulins? And then the other thing is, they say they've got trained personnel. But trained personnel to handle medicines are pharmacists, doctors, and nurses. And I do not see any of those being employed at a post office.
Look, on the face of this, it sounds like it could be a help to some people, because this is for people who usually go to government clinics. They may stand in long lines. They now have the option to go to the post office. So at least it can save them maybe a day. Maybe they want the service. But do you agree with the Pharmaceutical Society that maybe this could have gone to private pharmacies? I mean, what would have been the better solution here?
Absolutely. So I think the newspaper report stated that there were going to be 300 post office outlets. Well, currently there are over 3,700 pharmacies across South Africa, and only a few of those are actually pickup points for chronic medicines for state patients at the moment. So our first thing would be to say to the Department of Health, come and speak to us. We have very effectively assisted you with the COVID-19 vaccination rollout. And in fact, pharmacies really have been the backbone of the vaccine rollout in the private sector. And we've dealt with private and public sector patients. So come and speak to us. For those patients that are, for instance, housebound, they may be in bed or disabled, and they can't get into a state clinic, we have got other resources for that. So currently the state does have courier pharmacy that could deliver directly to the people that are absolutely housebound. But yes, I think the first thing we would say is, why go to the post office? Come and talk to us.
So it sounds like a lost opportunity for a public-private partnership that we often talk about in this country.
Absolutely. And I think I do understand that the post office is trying to reinvent itself, but then don't start on something as challenging as medicines and as important as medicines.
Yeah, the post office, I mean, I hope we can chat to them as well, but they have tried to clarify a few things because of some of the concerns that you've raised. They've said that they're distributing, not dispensing, that there has been some training, and they've clarified that if the medicine is not picked up, it does go back to the Department of Health within 14 days, rather than the usual, I think it's 2 months that a parcel can stay at the post office. Does that give you any relief?
No, not really, because medicines need to be stored in a registered facility. So currently, there are outreach stations for chronic medicines for state patients. But what happens is the medicines stay at a pharmacy or a pharmacy clinic, and then they go out to the outreach stations for the day. If they're not picked up, they come back to the pharmacy. So you're now going to take medicines and you're going to store them in less than perfect conditions for 2 weeks. And that's a minimum of 2 weeks, because they say that the medicines are available for collection for up to 2 weeks. Well, in 2 weeks, a lot can happen to medicine that is not stored correctly. So I would say, and also, in answer to them saying that their staff have been trained, they've probably been trained on how to track a parcel. This is not a parcel. This is life-saving medicine. And it takes a pharmacist 5 years to be trained to handle medicines.
All right, thank you very much, Jackie Maimin, CEO of the Independent Community Pharmacy Association.